Rosemary Batt is the Alice Hansen Professor of Women and Work at the Cornell University School of Industrial and Labor Relations. She is co-director of the Center for Economic and Policy Research with Eileen Applebaum, her research collaborator for over a decade, about the increasing role of private equity in healthcare and in other sectors of our economy. She has a book on the subject pending. She received her BA from Cornell University and her PhD from the...
There we are. Thank you so much, Judy. And thank you to Steve and Mandy and Morgan for all of the work you've done in putting this together. And I'm going to jump right into my presentation because we have a lot to cover. And I'm also going to time myself so that there's plenty of room for other people as well. So let me start private equity in healthcare. I've done all of this work with Eileen Applebaum, as Judy mentioned, and we've been working on this for 10 years. So I'm bringing together evidence-based research that shows exactly what private equity has done over the last several years. Let me jump in and first begin by saying we view private equity as the most extreme form of shareholder capitalism. And what we mean by that is that the mentality of corporations as only meeting the needs of their shareholders through maximizing profits is one that has taken hold across the United States and now is moving into healthcare as well. And so we view private equity as a more extreme form than a for-profit corporation, and I'll outline why that's true. Private equity creates a private investment fund and promises its investors outsized returns. And to provide those outside returns, it buys up healthcare providers, such as hospitals, to extract wealth, not to provide healthcare services. And how does it do this? It extracts, it cuts staffing, supplies services, reduces service access, sells assets, uses monopoly power to charge higher rents. And it has penetrated virtually every aspect of healthcare, as Judy mentioned, and it is almost completely unregulated. So it goes beneath the radar of regulators and the public. Now, what does it do to really change healthcare? I argue that it turns healthcare from a social good into a financial asset. So these are Wall Street financiers who view companies as pure financial assets or almost Lego chips to be bought and sold. And the visual that I have that I think reflects this is you can think of this as a hospital beforehand, before private equity, and this afterwards. So they pull apart organizations and pull off or buy the most lucrative parts, or they buy the whole hospital and then get rid of the less profitable parts in order to piece together those pieces that are the most profitable for them. So it extracts wealth through financial strategies, not by providing health services. Now let me go and give an example before I go into the model. You can see a visual here before and afterwards, and my point was that private equity pulls apart organizations and pulls out the most financially lucrative parts, maybe sells off the rest so that it can make the most profits. And it extracts mainly through financial strategies, not by providing healthcare. Okay, here's an example to show you what I mean. This is in nursing homes. It's a major study done recently. And the authors found that when private equity took over the nursing homes in across the state through several years of New Jersey, mortality rates in PE-owned homes were 10% higher than the overall average, but Medicare billing was also 11% higher, and frontline nurses spend fewer hours with patients in order to cut costs by the private equity firm, and the homes made 50% more use of antipsychotic drugs. So that's an example of where private equity is trying to squeeze profits out of the nursing home And the results are that patients suffer and Medicare bills go up at the same time. Okay, so let me now go into the business model of private equity. And this is a little bit complicated, but I'm going to walk you through it. So don't be intimidated by this slide. We can start with the private equity firm, which is owned by general partners. They create a private equity fund, and they get their money from investors that are mainly pension funds, institutional investors, or wealthy individuals. That is 98% of the fund. And the private equity firm, they only put in 1 or 2% of the money. So they are basically playing with other people's money. Then they require these partners, limited partners, to keep the money in for 10 years. And they require a 2% annual fee from those investors. And that money, so for example, the average private equity fund is now $1 billion. And so that means that 200 million, 2% annually times 10, goes off the top directly into the pockets of the private equity firm, and they can do whatever they want with that money. And there is no accountability. They do not expense the money. This is purely gravy for the private equity firm. The rest of the money they invest in portfolio companies. They buy hospitals, they buy nursing homes, etc. And they use only 30% equity, which means their own money, their equity ownership. And they then borrow an additional 70% from banks or creditors, so that they are investing only 30% in buying out a company. Then when after 5 years, they try to flip the company. And at that point, they get 20% of the profits. So here you have, they're only investing 2% in the fund, but they're getting 20% of the profits. So the investors are actually getting considerably less, disproportionately less than the private equity partners themselves. Now, they do this several times over because they have a fund, they're using a lot of debt, so they can spread their own money over buying several companies, and they can set up another private equity fund. So here's another one. So KKR, for example, now owns over 100 companies at once. And so if any one of those companies happens to go bankrupt, they don't really care, because they have many other companies, and the debt that they have put on the company is on the portfolio company. It is not on the private equity firm. So it's like having a mortgage, but having someone else responsible for paying your home mortgage. You're not held responsible. And so this ends up being bad for the companies and bad for the stakeholders, but the private equity firms make a lot of money in this process. So let me go further. Here is a strategy where they start with a high level of debt, and now they have to figure out how to make money, how to make outsized returns. So one way they can do it is operational. That's what all hospitals do. They cut costs if they need to. They try to get higher revenues. So that's pretty typical, but private equity tends to do this on steroids. In addition, they have what we call financial engineering strategies that I'll explain in a minute. And then the outcomes are they are managing for cash flow. They want to increase the flow of cash in order to service the debt that they have put on the company, but also to extract cash for the investors. And then the jobs and sustainability of the company are to be seen. Now, what are financial engineering strategies? The first, as I've said, is excessive use of debt that is loaded on the provider. And that means that there increases the risk of bankruptcy or poor financial performance. Then there's also that forces cost cutting in order to service the debt, as I've just mentioned. A second way that there is financial engineering is charging portfolio company fees. In other words, I'm going to charge the company for advisory services that I'm providing, and I'm the one who is in charge of the company to begin with, so I can kind of double dip, if you will. Third, dividend recapitalizations. Now, that's a very fancy word for simply meaning taking more debt, more loans out, and loading it on the provider, loading it on the portfolio company. And when I do that, rather than using that money maybe to make improvements in the hospital, I use it to pay myself a dividend. And so I'm going to take money, extract money essentially from the provider and pay myself a dividend. And these loans are considered junk bond status, which essentially means they have to pay very, very high interest rates, again, loaded on the portfolio company or on the healthcare provider. Then there is another way of sucking money out of portfolio companies, and it's called a sale leaseback. Here is where the private equity firm sells the property underneath a medical provider and uses that money, again, to pay itself a dividend. So it doesn't use that money maybe to, again, improve technology or improve services. It uses it for its own personal gain. The providers, the healthcare, the hospitals, for example, are saddled with long-term debt, inflated rents with escalators on property they once owned. Okay, and then finally, monopoly power. They target markets with potential monopoly power. They buy more providers and create a chain. So for example, I buy up physician practices, and then I buy up some more, and I load them into one corporation, and they're all in a local or regional area, so that I can control the market and extract higher rents in that way. The buyouts in healthcare tend to be so small, like 100 million, which is a lot of money, but a small enterprise, that they go below the radar of the antitrust monitoring of the federal government, because they only monitor buyouts if they're like 200 million or more. And private equity is responsible for 45% of the mergers and acquisitions in healthcare, even though they're very, very small players. Okay, now, how do private equity owned companies differ from for-profits? This is important. I've already mentioned capital structure. And so here, private equity uses 70% debt, but for-profit corporations maybe only 30%. So the for-profit corporations are not as financially vulnerable. Then the regulatory oversight, the transparency, the accountability are all little to none under private equity. And that's because they are almost not accountable at all to the Securities and Exchange Commission, whereas for-profit corporations have to submit very substantial reports to the SEC. And finally, risk taking, as I said, is very high under private equity, not so much under for-profit corporations. Then, in addition, there are asset sales, which I just mentioned, that are very, very frequent under private equity ownership, but quite rare under for-profits, because they want to hold on to their organizations and they're not going to sell them. The debt used for dividends is very frequent in private equity, not so in for-profits. The fees paid by the enterprise are large. There are no fees charged by for-profit corporations. The taxes under private equity are a low capital gains rate as opposed to corporate income tax. And then the reputational risks are low. When people see a hospital that is poorly run, they make the attribution to the hospital, but it may very well be run, as in the Steward case I'm about to show you, by a private equity firm who's hiding behind the name of the hospital. So we never see who is really owning the hospital and the kind of shenanigans they're pulling behind the scenes. Okay, here I'm going to give you a few cases to illustrate what I just said. First of all, Sequel Youth and Family Services. They provide residential treatment centers, autism, mental health programs, and operate in 15 states, 40 facilities. This is private equity buying and horse trading. In 2010, they were bought out by a private equity firm called Levin Leichman. 2013, that private equity firm sold it to another one called Alaris. 2016, Alaris does a dividend recapitalization. That's where they load a lot of debt on the Sequel Youth Services and they take out a dividend for themselves. And then 2017, they go ahead and sell it to another private equity firm. They've made their money. Now they're going to roll it over to another private equity firm. So how does it make money? Well, it's 100% funded with taxpayer dollars by Medicaid and Medicare that charge very high rates per day per child. And this is a quote from the owner. He says, "We get paid on time and it's government money and there's plenty of it. And that's what makes this an ideal business to invest in." So we're doing this all on the backs of taxpayers. I'll go on a little further. What's the impact on healthcare staff? They hire unqualified, low-cost labor, no background checks, low staff-patient ratios. And here's again the owner saying you can make a lot of money in this business if you just control staffing. They willfully have failed to report patient abuses to the authorities. And then the impact on children is absolutely horrible. This is a case that has been in the news. It's been well researched by a number of organizations. Patients' rights groups and state investigators found widespread abuse in 18 states. The foster children moved to out-of-state locations around the country. Verbal, mental, and sexual abuse, improper restraints, rampant violence, and in one death, a tragic story where a Connor was horrifically brutalized sexually, physically, and emotionally by other residents because there wasn't supervision. So this is a really horrific example of what private equity can get away with. And there are suits now going after them, but it doesn't matter because Sequel, while their contracts have been canceled, they just move on. They move on to other states and they're still in operation big time. Okay, hospitals. Here's an example of Steward. And we find that in 2011, a private equity firm named Cerberus bought 6 hospitals in Massachusetts, Catholic hospitals, and they were required by the Massachusetts Attorney General to hold on to them for 5 years and do charity care and invest because they were nonprofits being converted to for-profit status. Once they did that for 5 years, then the Massachusetts AG stopped monitoring, and what happened? Well, in 2016, they did one of the sale leasebacks. So they sold all of the property for $1.25 billion from under the hospitals. And then Cerberus paid itself $500 million off the top in dividends. Then it went on, the hospitals were saddled with long-term leases on property they used to own, and their leases increased at 3% a year. This is hospitals that had owned their places since the 1800s, and now we're paying inflated rent in Boston. 2016 through 19, Steward went on a national buying spree and got 33 hospitals in total through horse trading so they could get bigger and bigger for their monopoly power. And in 2019, Steward was found to be the worst performing system in Massachusetts, highest debt, higher than average patient falls, infections, patient readmissions. Investigations found vendors were not paid, understaffing, etc. So that's Steward. And finally, it exited by selling the whole system to a group of doctors, and it made pure profit of $700 million. Now, I'm going to give you just a couple more examples and close. Here is Prospect Medical. Now, it focused on safety net hospitals. So in between these 8 years, it bought 20 safety net hospitals. It used extensive debt, cut costs, cut labor, stripped real estate, just like Stewart. It collected $658 million in dividends and fees, despite telling the regulators in the state it was not going to do that. And it received over $300 million in CARES relief in 2021. The Rhode Island AG has set conditions for its conversion, but that is still pending. And the Senate oversight hearing delved deeply into Prospect, and that is still pending. Okay, now I want to move to a couple more points. Surprise medical billing. Maybe you've heard of that. It's where patients find that they go to an emergency room and they get stuck with a very large bill that they didn't expect because they thought their insurance would cover it. And this has emerged because hospitals have needed to outsource, or say they need to outsource, their emergency rooms because of the costs. So this has become a trend across the United States. But what many people don't know is that the leading emergency room staffing companies are owned by private equity. So 40%, there are two companies, Envision and Team Health, and Dr. McNamara will talk about them, employ 90,000 healthcare employees, control 40% of the market, and they are the leaders in supplies medical billing, charging thousands to patients that didn't expect it. In 2020, they spent millions to try to prevent legislation that would ban surprise billing. And in 2021, the California doctors filed suit, and this is what Dr. McNamara is going to talk about. Okay, the same for emergency air ambulances. There are two private equity owned carriers that control 65% of the market. They had average charges per ride of $48,000, far more than any other competitor. They are not covered by the ban on surprise medical bills, and they particularly affect, of course, rural towns where hospitals have closed. So let me just show you, this is the graph that Judy was referring to about the rise in private equity funding. It has risen 25-fold in just 20 years. And so it is a very serious actor in the healthcare space that we need to be very concerned about. And so finally, wrapping up, it is interested in market opportunities because the market is fragmented and market demand is rising. And there are niches like outpatient and behavioral health that they're very interested in. And on the supply side, there are hospitals that have these financial pressures. So in conclusion, private equity shifts the primary goal from serving patients to extracting wealth for outsized returns. Leverage debt, property sell-off, dividend recapitalizations undermine financial stability. Targets are hospitals, nursing homes, patients. And finally, most importantly, hot markets are mental health, hospice, and home care, where many people are dying. And they extract wealth at taxpayers' expense. And we'll talk about this later. I'll just put up these general points. These are examples of how we could regulate private equity. So by increasing transparency, limiting leverage, discouraging these financial tricks, closing tax loopholes, holding private equity firms accountable as employers, and updating the employment, bankruptcy, and pension laws, as well as then healthcare specific legislation. So I'm going to stop and turn it back over to my friends. And I'm very sorry for the slow start that we got.
That's perfectly well. Thank you, Rose.